Hi everybody, it's Honest John. Eating disorders are conditions in which the individual engages in abnormal eating habits. They may involve either insufficient or excessive food intake, which get to the point where they're harmful to the physical and mental health of the patients. Anorexia nervosa and bulimia are the most common, but there are also binge eating disorders which seem to have to do with guilt. People who do the binge eating eat and then feel guilty about it, and then their self-image goes down the tube as they gain weight. These are the people who get morbidly obese, and they get comfort from eating, but then they also feel guilty. There's also an illness called pica, in which the person eats non-food items. I worked with one patient who, boy, you had to watch him like a hawk. He was really quick, and not only would he eat non-food items, erasers, pencils, but also sometimes sharp objects like pins. And he had to have several surgeries in order to remove some items that it was just not safe to allow him to try to pass through the intestines. One of the most common problems with pica is either perforation or blockage of the intestines. The most common eating disorders are anorexia and its close cousin, bulimia. Anorexics, well, it's exactly what you think it is. They starve themselves. Bulimics will eat but then immediately purge, usually by self-induced vomiting. Both bulimics and anorexics tend to overexercise to the point of exhaustion. They tend to use laxatives and enemas and diuretics. And both appear to have a distorted body image in which no matter how thin they are, they perceive themselves as fat. And these are very dangerous illnesses. I worked with a young lady, a beautiful young lady, anorexic, and she eventually succeeded in starving herself to death. It was pretty tragic. Men are not immune to the disorder, but the majority of both bulimics and anorexics are women. The specific causes of these disorders are pretty much unknown, although media images idealizing slimness are thought to contribute, peer pressure, anorexic women tend to be passive and compliant with dominating parents, and anorexia and bulimia are often associated with sexual trauma such as rape or child abuse. And they are both often seen in people with other psychological disorders, especially the personality disorders. There are a wide variety of treatments used in these disorders: behavioral therapy, individual and group therapy, family therapy is very often used, medications, and as a staff member, basically my job was to monitor the patient's eating. With someone with pica, you had to make sure they were eating food and not other stuff. With anorexics, You had to make sure they went to the meal, and you recorded what they ate, and made sure that they weren't trying to bullshit you by slipping their food to other patients and pretending that they ate it. And of course, with bulimics, you had to stay with them after the meal to make sure they didn't purge. And also monitor their exercise, and making sure that they weren't sneaking laxatives. You have to be constantly alert and very patient, because working with people with eating disorders is crazy making. And that's the thing about, I think, all of the mental illnesses. Yes, the patients suffer, but a lot of times they're almost oblivious to their pain. And the people who really suffer are the ones who care about them. Thanks for listening.